The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass, and of course, our technical producer, who is not here today, but we have John Bazika. Is that correct? Working for us today and working hard, man. So in the studio with me is Brad White, a compounding pharmacist, and David Morris, trauma-certified registered nurse. David, welcome to the show. Again, thanks for joining us. We're looking forward to talking with you today.
Morning. Thanks for having me.
All right. Today it's a busy day here. Patient volume in the emergency department has been growing faster than the population for decades. Nationally, there are approximately 140 million emergency departments visits annually, with an estimated 12% of those visits resulting in an admission. We all hope to avoid these visits to the emergency department. As Mercy's Injury Prevention and Outreach Coordinator for Trauma Services, David is here to give us all the tips and knowledge to help us avoid visiting the emergency department. So today we'd like to remind our listeners that our program is available on our podcast, so you can grab this from the App Store on your smartphone. And before we begin, we also wanted to just give a little bit of a public service announcement for the current concern with coronavirus. The best thing you can really do is make sure that you maintain good hygiene. Wash your hands well. There's a nice, believe it or not, there's a nice video and directions on the CDC's website on how to wash your hands properly. You might learn something. You'll be surprised. We're going to post it up in our show notes today so you can take a look at that. But you also have to keep in mind to taking care of yourself. So you're going to need to make sure that you get adequate rest. You want to make sure that if you haven't had a flu vaccine, you really ought to get one of those so that you can be protected from the flu, because the flu currently is affecting more people than the coronavirus is in the U.S. And we also have some supplements here today that we were going to talk about, but even just a simple multivitamin can reduce your risk of getting the common cold by over 20%. So whether it's a multivitamin or a specialized herbal supplement like we have to help you boost your immune system, there's things you can do to prepare. So keep your hands clean, make good decisions with interacting with your family, friends, and the public, and don't be afraid to boost your nutrition status and get some good rest.
Okay, Dave, welcome to the show again. Tell us a little bit about yourself and what's your background?
Well, I am a trauma-certified registered nurse. I work at Mercy Medical Center. Been there for about 12 years now. Started in the emergency department as a tech there and graduated nursing school. Worked in the ER as a nurse for a little while, and then came to Trauma Services, and I now work as the Injury Prevention and Outreach Coordinator.
What do you do?
That's a good question. I get that a lot. So basically, as the Injury Prevention Outreach Coordinator, as a trauma center, you have to do some sort of outreach, injury prevention to try to decrease the numbers of traumas in your area. So my job is to go out and basically teach people how to not get hurt. I teach classes to the elderly about fall prevention, pedestrian safety, bicycle safety with children, things like distracted driving, stop the bleed programs, things like that.
Okay, downtown Canton, we have bicycle paths.
Uh-huh.
And I've had for what? Not too long, okay? 2, 3, 4 years, maybe,
Yeah.
I don't know. How many injuries come in from those bicycle paths?
To be honest, I don't think we have too many bicycle-related injuries that come in. I think the bike paths must be working in that regard. Mm-hmm. But yeah, bicycle-related injuries, and especially, with children, sure. But with the bicycle paths, adults, things like that, I don't think we get a great deal of them. So
I know the library had a program. I don't know if they're still doing it, where you could borrow a bike.
Uh-huh.
The Canton Library, and of course there's bike paths there.
Yeah.
And they're on, is it Walnut? I think they're on Walnut and maybe Cherry. I'm not sure, but I've never seen anybody on the bike path.
I don't see many people on them either, but at least they're there for the people that want to use them.
For sure. So, what other than what you just explained,
Mm-hmm.
what exactly does Trauma Services do? It sounds to me like you take care of patients, but
That is a common thing that people think. So Trauma Services, we do work with the emergency department, but it's kind of its own separate entity. Our job as trauma services at Mercy is to follow the patients that come in as traumas with injuries from the time they come in the door, usually through the emergency room, to the time they leave. The things that happen during that time. So we'll look at that whole visit. We'll identify any problems that came up, and we're constantly working with all the departments that those patients go through to provide the best care for our trauma patients. So yes, we do work very closely with the emergency department.
So trauma is what? Accident?
Trauma is basically any injury. Any injury that was caused in a traumatic way, a fall, a motor vehicle accident, things like that, gunshot wound.
Broken bones.
Yep.
Fractured skull.
Yep. All that we track, and we follow the whole hospital visit.
Okay.
So
I understand Mercy Trauma Services is a verified level 2 trauma center. What's that mean?
So the verification process is something that the American College of Surgeons does for trauma centers across the United States. And every 3 years we get a verification visit and they go over the care of our trauma patients, how we've evaluated them, and our performance improvement processes and things like that. And we're a verified level 2, which means that as a level 2 trauma center, we can handle any injury that comes into us, from a fall to things like gunshot wounds, traumatic brain injuries, things like that. Any type of injury can come to us, we can treat it. In the rare instance where it's a very, high acuity case, we don't have the type of facility that person needs. We will transfer them to a higher level of care. But that's a really specialized instance. Really, we can accept any trauma that walks through the door.
So I guess just for fun, I'm thinking level 1 is like your garden variety emergency room, but level 2 is a whole nother level. Is that fair? Because I guess I'm thinking, okay, level 2, level 1.
The differences in trauma center levels, there's a couple different ones, but level 1 is the highest level that you can be.
Okay.
For example, Akron General, SUMA and Akron, they're both level 1s. But the only real difference is that they have specialized surgeons on or in the building all the time. Ours have a 15-minute response time, something like that. And then they do research and things like that and publish papers. And we don't necessarily have to do that. But again, as a level 2, we accept and treat all traumas, all levels. So
People wonder why health insurance costs so much and healthcare costs so much and all these things that, when I was a kid, I cut my hand. They took me up to the doctor's office and he stitched it up. At the doctor's office.
Yep.
I'm thinking, today, now, healthcare, that would be in the hospital immediately. Or sooner.
Or stat care or something.
Or something. Yeah, sure. So it is really amazing that how much things have advanced and how much care is really available.
Yeah, for sure.
And I listen to some of these people complain about not getting care, and I'm thinking, boy, I remember when I cut my head.
Just going.
Okay, well, where would we take you? I don't even remember how they figured this out, but there was a doctor in North Canton that he said, "Okay, I'll meet you up there, at the office." And put 40 stitches in
Took care of you then, huh?
Yeah. So it's just, and there were no ambulances when I was a kid either.
Yeah.
Funeral homes moved people.
Wow.
With their hearse. I mean, we didn't even think about that.
Times have changed. Yeah.
Yeah, for sure.
So what about, you just touched on something. How about when do you go to the emergency room versus when do you use a stat care, if you don't mind?
Oh, great question. So ideally, we reserve the emergency department for emergency situations. Stat cares can handle a lot of things, common sicknesses, but if you have any type of, injuries where you might need a CT scan or things like that, or, we do offer those at outpatient levels at some of the stat cares, but ideally you would come to an ER for that. Basically, if we can reserve the ER for emergency situations, that's what we try to get the public to do, to avoid overcrowding and things like that. So, but if you have any medical emergency, you need help, we are available. Come in.
So just for fun then, going to the emergency room is for like heart attacks, broken bones, not sore throats,
Ideally, yes.
and
That is
ideally
correct.
not like, those kind of things.
Right,
So,
right.
All right.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com.
Okay. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dave Norris, trauma certified RN from Mercy's Emergency Department. Have a question? Post it on our live Facebook feed.
All right, Dave, let's talk about winter safety. It's March, it's March 6th. It's looking like we're doing pretty good for winter in Ohio this year. So, but for good measure, let's talk about what you see an increase in winter-related injuries and how we can be mindful so that we don't find ourselves in that awkward position.
Sure. So, during the winter, I guess the obvious injury that increases is falls. Snow and ice are obviously going to lead to falls. So, take your time, slow down. That's the biggest thing. Everybody seems to be in a rush nowadays for seems like no reason in particular, but other injuries, broken wrists from those falling on the outstretched hands, hip injuries, arms, unfortunately head injuries, brain injuries from those falls. But falls are our number one mechanism of injury year round. So we just see that increase during the winter. So
Does frostbite fall in your category?
yeah, frostbite is an injury, is a traumatic injury. So frostbite is never anything anybody wants to experience. So keep bundled up.
Anything that you would recommend our listeners do to reduce their risk of falls from snow and ice outside their home?
Yeah, like I previously mentioned, slowing down, that's the biggest thing. Take your time when you're walking around snow or ice. Try to keep all your walkways and pathways cleared of ice and snow. Salt them if you can. And sounds like a simple thing, but pick the right shoes. Pick the right shoes for the right occasion. If you know that you're going to be going across some ice or snow, don't wear those high heel shoes or anything like that.
Or the Crocs.
Flip-flops, or the Crocs. Wow, the Crocs, yeah. The Crocs are pretty popular right now, and those, I can't imagine, are too good on ice and snow.
What about inside our homes? There's got to be ways we can reduce fall risks during the winter months or even the year-round.
Absolutely. Year-round, I guess it does apply to year-round. First and foremost, get all the clutter that you can out of the way. A very high percentage of our falls are mechanical falls, just people tripping over something. So especially in the areas that you commonly walk through, hallways, things like that, try to remove clutter that's on the floor. Big things, area rugs, that are on tile surfaces or things like that. Those are very big fall hazards. If you can put rug tape on those, fantastic, or just do away with them immediately. Wiping up spills is something that, you might be cooking or something in the kitchen. You accidentally spill something and you still want to continue what you're doing. Oh, I'll get that in a second. Wipe that up immediately, because more times than not, you forget that that's on the floor and you turn around and end up slipping. So, and then things like exercise, work on leg and ankle strength. Those muscles that really help you control your balance or catch your balance in the event that you're going to fall.
We're really spoiled about conveniences, and I guess I don't really consider electricity a convenience, but I guess it is. And, what about preparation for, like, winter emergencies, power outages, heats out? What do we do about that?
Sure. So, especially in places where, you might have well and you have a well pump that controls your water. Great idea to have some extra water on hand throughout those winter months. Stay warm the best you can. Always have, blankets and things like that available. Keep things like a first aid kit, emergency blankets, like I said, extra water, a flashlight, couple candles around, and maybe something that you don't think of, one of those external batteries for a cell phone. Have you seen those?
Yeah, sure.
Just so that you can keep that cell phone charged in case you have to make any emergency calls or talk to family and things like that. So one of those external batteries is actually something that people might think about putting in their emergency
So
kits.
many people have given up landline phones,
Right, exactly.
which work with a
Right.
power outage generally, but it's, to some extent. But so what do you got? You got nothing unless you got to charge.
Unless you have that external battery. So
Yeah,
I
exactly.
think that's becoming almost a common thing that people are starting to put in their emergency kits.
Yeah. What about your car, your truck, or whatever you're driving? What are we doing inside of that to make sure we get stuck out in the middle of nowhere? That sort of thing.
Yeah, same kind of stuff. If you can afford a pack of bottled water, fantastic to keep in your trunk. First aid kit, I have one in my trunk all the time, just in case anything were to happen. Especially those to keep in the car would be emergency blankets you want to keep warm, and things like a flashlight.
Yeah.
External battery would be great, but yeah, very similar to the house things.
Some of the newer
Should just transfer in.
flashlights that are out there will last forever almost,
Yeah,
and are very,
Very
bright,
cool, yeah.
very bright with the LEDs, and it's really a fantastic change from double
Absolutely.
D batteries
Yeah.
or something like that last a couple of minutes. When you turn the thing on,
you got these
So,
tiny flashlights now that put
yeah,
out.
yeah, it's amazing. It really
Yeah.
is. So, carbon monoxide poisoning, and that sure fits into your division, I would
Mhm.
suspect, and so many people just don't get it. I mean, I've heard of so many deaths,
Yeah.
over the years.
So carbon monoxide is tricky because, unless you have a carbon monoxide detector, you don't know you have a problem until you start experiencing symptoms. So, and hopefully it's not, too late by that time. But so first and foremost, I would always recommend getting a carbon monoxide detector, making sure that has, new working batteries, checking that out. And then if you start to experience just out of the blue headaches, nausea, vomiting, then seek medical help and probably get that tested.
Some people turn their cars on for a length of time
Right.
in the garage
Mhm.
or whatever. In fact, there's a friend of mine years ago that his house was such that the car was under the bedroom,
Mm-hmm.
and
Oh, wow.
he was a habitual leaving his car run all the time.
Yeah.
And they went home. He and his wife went home one night, and he left the car running in the garage, and they didn't wake up.
Wow.
So,
Right. Bedroom right above the garage, huh?
yep, for sure. How crazy is that? Huh?
Wow.
But this guy he habitually left his car run.
Yeah.
He'd get out and go to the grocery store, leave the car run. Crazy stuff. So, what about people who spend a lot of time outdoors? And I mentioned a few minutes ago about frostbite, skiing, precautions for that sort of thing.
Sure.
I know we sell warming gloves and
Mhm.
things like that, and I think we actually have some hand warmers in one of our stores. So, what do we do? Feet?
Yeah. Best thing that you can do, like you just said, with feet and gloves and things like that, get good gloves, good socks, keep warm, a good hat. You lose a lot of heat out of your head. So, but more than anything, just layer up. The more layers that you can put on, the better. It's not always about, how many you can, or it's not always about the extra clothing. It's about that air in between the layers, buffering that cold for you. So, the more you can layer up, the warmer that you're going to stay. So if you're spending any extended amount of time outdoors, please layer up.
You already touched on some car safety, but what if you're planning a road trip over a distance? Sometimes weather can be unpredictable in the Midwest. So what would be your best practices to prepare for a journey?
Well, get your car ready for that long car ride. Maybe have those emergency things that we talked about on hand. But when you're out there, just, again, slow down. Don't be in such a hurry. There's really nothing worth getting injured about. There's very little things worth, going fast in that ice and snow. Watch the road. Distracted driving is becoming a huge problem with cell phones and things like that. It's just so easy to take your eyes off the road. 3 seconds, you can travel the length of a football field going 60 miles an hour. So it's really important. And also don't tailgate. And especially when it's snowy out or rainy out, you have to, every time that you're behind a car, think, if that car stops right now, do I have time to stop also? Yeah. You see so many people just way too close to when it's snowing and raining. So
I had one pull out in front of me yesterday.
Oh, yeah?
I don't think there was that much distance between our vehicles.
Wow.
Okay. I don't know how I didn't hit her. She was talking to the lady sitting beside her, in the car. And wasn't on the phone, but they were just chatting away, and she wasn't paying any attention to the roads.
Yeah.
Okay. Our second break is here. You're listening to Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing safe habits with Dave Norris from Mercy's Injury Prevention Department. We've got a lot more to cover this morning, so let's get back to the show.
All right. Well, with winter, we think of colds and flus and viruses and any vaccines we should be mindful of before we head into the winter months.
Yeah. So vaccine-wise, I think first and foremost, right off the jump, you mentioned the flu vaccine. The flu is a big deal, especially for children and the elderly. So anybody over 6 months can get the flu vaccine. And again, any children, elderly people, we recommend it even more so for them, or anybody who has like pre-existing health conditions, especially like respiratory issues and things like that. For sure, get the flu vaccine.
All right, sounds good. How about I talked a little bit about proper hygiene without giving away too many details. So how about you talk about proper hygiene and even sneezing and coughing? How can you make sure that you're a responsible person, even if you're struggling with that cold or flu symptom?
Right, that's a good question. So a responsible person is a good way to put it. So covering your cough, first and foremost, trying not to expel more germs out into the air than you have to is kind of key. So if you have a tissue, that's ideal. Sneeze into a tissue. If you don't, just cover your cough any way you can. They recommend doing something like what's called the vampire cough, coughing into your inner elbow. Those old Dracula movies where he puts that cape up. So coughing into your inner elbow is always a good option.
Is that where that came from?
That is, I think that's where that came from, the vampire cough. So,
okay.
And then make sure that you're always washing your hands afterwards. So always cover your cough, always wash your hands.
We were talking about hand sanitizer before the show, and now there's none out there unless you pay $100 a bottle for it.
Yeah.
So proper hand washing, what do you hear? 20 seconds of soap and water in warm water.
Yep.
Dry your hands properly, that sort of thing.
Mm-hmm.
I actually heard I don't know if we should even say this. I even heard this home remedy for hand sanitizer on the radio this morning. And it's kind of scary because if you mix it up yourself, you don't have it in the bottle with all the warnings on it, that sort of thing.
Right.
So I don't think I'll go there.
Mixing up your own.
The humorous one, it was the vodka. So
yeah,
using that to wash your hands and stuff like that. So, but that could be a real problem if you're driving down the road. So
yeah, for sure. With the vodka, for sure.
So how long do I have the numbers right? Or
yeah, absolutely. 20 seconds at least is the recommended amount of time that they suggest you wash your hands. That's going to give you the greatest amount of success, the greatest coverage. Try to get under those fingernails if you can. And like you were talking about with the hand sanitizers, if you have access to some right now, great things to carry around on your person. Sure. Especially when you're out in public in large groups, anytime you touch a doorknob or something, those common places that people are touching, very beneficial and very convenient to have. So yeah, but 20 seconds hand washing should do you good.
For some unknown reason, we had I don't know where the camera is. We had a major rush yesterday on hand sanitizer. I mean, we had a ton of it on all the shelves.
Yeah.
They wiped it out in a day.
Wow.
So I don't know, something on the news. It was sort of all over everywhere. I think on the radio, stuff like that to get it, and
Yeah.
that sort of thing. So,
But don't fret, because soap and water works too.
Yeah,
So
sure.
It's,
Soap and water is great.
Sure.
Soap and water is fantastic.
Yeah. So I think most hand sanitizers are all alcohol based, right?
Yeah.
I've seen some others, but
Yeah, there's some natural ones out there.
Yeah.
But for the most part, if you want the most efficacy, you go alcohol based.
yeah.
So kills
And I
most
think
everything.
most of those are 60% alcohol or something like that. So okay, let's jump over to flu, influenza. What are the symptoms?
So flu is, primarily affects some respiratory things. You can experience some nausea, vomiting with it. That is a symptom that some people get. But more times than not, you're going to have fever, chills, cough, things like sore throat, a runny or stuffy nose, fatigue, and I guess the telltale sign, whether or not, hey, I'm having a common cold versus, hey, I'm having the flu, a lot of times is that like very extra fatigue and body aches. You have that muscle and joint pain. That's often a telltale sign to tip you off, hey, I'm having something more than just, the common cold.
And the corona is about the same, right? Isn't that similar, the symptoms?
I honestly, I don't know if I could speak to that, but I would imagine it's a virus,
You know what? I don't know that in the media that I've really heard the symptoms of that. I mean, it's not,
Right.
It's not.
Yeah.
Like, it's just everybody's trying to scare everybody.
Right.
Well, it is on the CDC's website, so I mean, it's something that you're going to have symptoms that are similar to the flu, but they're generally more severe, and it's generally people that are being affected are kind of like what you commented on, who should really get the flu vaccine. Older patients that are at higher risk for contracting conditions or diseases, or maybe involved with patients who are possibly going to be carriers. So yeah, if you're not feeling well, you should make sure that you seek out medical care, is basically what it comes down to.
What do we do if we have the flu? We think we have the flu.
So if you think you have the flu, the one of the best things that you can do is rest. Stay home and rest. The flu's a virus, so it's just going to take some time to run its course. Antibiotics aren't going to help you in this situation. Drink as many fluids as you can. Rest. And treat your symptoms.
Mostly water, right?
Yeah, exactly. Treat your symptoms though. If you're having, problems with fever, maybe take some Tylenol. If it gets too high, but you have a cough, maybe take some cough medicine. But it's just going to take some time to run its course. There is an Tamiflu antiviral that will supposed to shorten the length of the flu if you get it on early enough, but oftentimes it's
Yeah, like you said, it can work, but you can't think you're tough and wait for
right.
2 or 3 days and think, oh, this will get better, and because then it's too late, because then it won't work.
Absolutely.
So, I guess I've heard that sugary liquids sort of feed the flu. Is that?
I mean, that could be true. I don't know.
Or any
the research
infection,
on that.
really. The
The
sugar is like a nutrition
right.
for some of the bacteria.
I have heard that before. Yes.
I mean, I'd never. I only saw one crazy place. But
And then obviously, if your symptoms get too bad, I guess I should mention that. If your symptoms do progress, and you need medical care, obviously, come get it.
So how about that? Okay, at what point should you, if you've got the flu and you're miserable, when is the time? Like maybe you don't normally have vomiting with the flu itself, but let's talk about maybe dehydration and when the risks happen, because especially with kids,
absolutely,
that can be really dangerous.
Yeah, so fevers are going to cause you to get dehydrated faster. You're just going to lose that extra water through all the body heat that you're producing. So you really look out for signs of dehydration. Especially in children, it's like maybe a decrease in urination. That's for adults too, but decrease in wet diapers, things like that. But look out for those respiratory issues too. If the respiratory status is kind of declining, you might need a breathing treatment or something like that, because mainly the flu is going to affect that respiratory system. So especially if you have the pre-existing conditions, things like COPD, and you get sick and you think it's going to get bad or it has gotten bad, absolutely seek medical attention. Listen to your body. You'll know where that tipping point is to where I should be going to see somebody.
Flu around us? I mean, the schools and all that.
We've had it. I think, in all honesty, it hasn't been as bad as years past, but we have seen plenty of cases still. I believe it's flu B this year, if I'm not mistaken, that we're seeing a high number of cases.
That's what I'm hearing.
So, yeah.
Okay. I just haven't heard of any school closings.
No, I think we're doing fairly well with it, but yeah, we've definitely seen plenty.
Is there any sort of a program with the schools where they give flu shots in the schools, or is that?
That's a good question. I actually don't know the answer to.
I guess that would require patient or parental
for sure,
signature, all that kind of stuff to do that. But I'm surprised that I remember years ago when I was in school, they came in and give us injections for stuff, but I can't remember what it was for.
Yeah, you just did it.
Well, why don't we talk about a little bit? We've kind of hinted at it already earlier in the program, but for listeners just joining us, why don't we talk about ways to boost their immune systems throughout the winter months?
Sure. So first and foremost, don't smoke. Smoking really does a number on your immune system, and not only that, it can do some stuff to the natural defense mechanisms of your body. You have these cilia that try to move bad stuff out of your throat and lungs, and it just doesn't. Those don't work if you smoke. So you're kind of doing yourself harm by doing that. Alcohol, reduce your alcohol intake. That can affect your immune system pretty greatly. Make sure that you're taking a multivitamin. That really helps. Eat your fruits and vegetables, good source of vitamins and minerals, and try to reduce your stress. I know it's easier said than done, but stress does a number on your immune system as well. So, that's just a couple ways. But yeah, like you have up here, the multivitamins and things can really, really help boost that immune system.
We've had many dietitians on the radio program, and particularly from your hospital.
Mm-hmm.
It just seems almost impossible to figure out how to get the masses to eat a good diet.
Yeah.
Balanced vegetables and meats and stuff like that,
right.
Protein and things. It just almost seems impossible. So where do we go next, huh?
Try our best.
Education.
Yeah, education. Okay. Third break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
One of the things that often comes up in the winter, and I've heard things like this in the pharmacy happen what do you recommend for checking on elderly patients or loved ones that maybe aren't as ambulatory and active as they once were? So
that unfortunately happens. It does happen where that elderly person maybe doesn't have contact for a couple of days, and then you come to find out that maybe they had an injury or some sort of medical occurrence like a stroke or something like that. So if somebody does, live on their own or they stay home a lot, I guess your contact with them should be based on their activity level 1, and their mental health. So, somebody with more diseases or things like that, comorbid factors, you might want to check in on more often, especially during the winter and things. I would say at least a phone call a day, and because of that increased risk of injury during the winter, maybe visit more often than you would normally throughout the year. So, but at least give them that phone call a day and check in on them so that you don't miss anything major.
There's a lot of sort of getting together events right now, like the fish fries and all that sort of thing.
Mm-hmm.
And it would seem to me that since people don't get out in the winter, very much, that any groups, large groups or whatever of people are kind of a not going to say it's a no-no, but just be careful. Make sure you wash your hands before you go in. Make
Yeah,
sure you wash
large
your
groups
hands.
of people, especially nowadays or right now. Yeah, always keep those hands washed,
It's-
cover those coughs.
It's just one of those things that it is a sort of a religious event time, but
Mm-hmm.
and there's a lot of people going to these events, and they just need to be careful. So.
Right.
All right, Dave, let's talk about fall prevention. You mentioned that earlier in the program. What types of fall prevention programs does Mercy Trauma Services offer?
So at Mercy Trauma Services, we offer some great courses for fall prevention. They are geared mostly towards the elderly because that's where, unfortunately, that's our highest population for falls. So at Mercy, we offer a course called Matter of Balance. That's one of our courses. It's an 8-week course. It's a 2-hour class once a week, and we go over how to deal with the fear of falling. We do some light exercising, things you can do at home. We talk about ways to reduce falls. It's a great place where people can kind of share their experiences, and we give you tips. We give you grab bars, rug tape, things like that. But we also have a course called Tai Chi, Moving for Better Balance, where we do Tai Chi. They're modified Tai Chi forms. Tai Chi has been evidence-based. It's an evidence-based thing, and it's been shown to reduce falls in the elderly population. So that's another free
I am not
class that we
familiar
get.
with that at all.
Tai Chi. So
Yeah.
Tai Chi is basically it's an ancient martial art that's been kind of slowed down. So I'm kind of doing the moves without thinking about it. Think yoga in a sense. It's
Okay.
very slow position holding movements where we really focus on strengthening the muscles in your legs and ankles and things like that. So
Okay, why does that help?
Well, by holding those positions, the way that we do the forms, like I said, it's kind of like a slowed down martial arts. We're shifting our weight. We're using certain muscles in our legs and our ankles to strengthen because, when we're stepping on something, the first muscles that send a message up to our brain to respond are our ankles. If we roll this way, we roll that way. We can adjust our balance very quickly if we strengthen up those muscles. So,
Very interesting.
yeah.
So you got muscle strength, you've got balance,
Yep.
and then you got a little bit of coordination and
Absolutely.
spatial awareness too. So you got all those things.
Yeah, that class has been pretty successful. Tai Chi, Moving for Better Balance, and both of those courses are free to the general public. So,
Now, where are those held?
I'm organizing a class, Tai Chi class at the hospital, but currently we run the Tai Chi out of our North Canton Stat Care. They're on Whipple. So, and then Matter of Balance we also hold at the North Canton Stat Care on Whipple. But again, thinking about organizing a class at the hospital as well.
In the building in the back there?
Yeah,
Okay.
exactly.
Yeah, great room there.
Yeah.
All right, super. What about your trauma services program, Stop the Bleed? That sounds a little scary. So tell me what we're doing here.
So Stop the Bleed is a nationwide White House initiative. It came about, the government found a need after the unfortunate rise in mass casualty incidents across the U.S. So the goal is to educate the general public in bleeding control. So Stop the Bleed, again, a free program that we put on through our outreach, where we teach the general public just basic bleeding control techniques, 3 of them: direct pressure, wound packing, and how to properly apply a tourniquet. Because blood loss is unfortunately the number one cause of death, the number one cause of preventable death after any injury. So we're trying to educate as many people as we can on how to stop the bleed, because depending on how and where you're injured, it can take as little as 3 minutes for you to lose enough blood to where you go into shock and can eventually pass away. So
Yeah.
just something that we feel like everybody should know, and we've been educating as many people as we can.
All right. Is there anything you'd like to add to our listeners to keep them safe out there, and out of Mercy's emergency department?
Out of the emergency department.
Except for coming to your informative classes.
Yes, the informative classes.
Well, and if they really need it.
Yeah, exactly. So I think we covered a lot of ground here. Stay warm, stay safe, slow down, make sure you're covering that cough, especially now. Make sure you're washing your hands, and take it slow when you're walking or in the car. As far as the programs go, any of the programs I talked about, if you want to go to cantonmercy.org/trauma, my email link's on there. It talks about the programs that we offer. Feel free to email me. Again, free programs that we offer through Trauma Services. So if anybody's interested, let me know.
Excellent. Is there anything coming up in the next, this is the end of the first week of March. Are they scheduled throughout the month, or how does that
they
work?
are scheduled throughout the month. We kind of have an ongoing class right now, but anybody who wants to take one gets put onto a list, and I contact you right before the next class starts. So,
okay, very good. All right. Well, why don't we wrap up here today with some good hand washing reminders? How about that? You want to touch on that?
Good hand washing reminders. Like I said earlier, make sure you're taking the time, especially when you're out in those public places with lots of people around. And if you're touching anything that's commonly being touched, like those doorknobs and things like that, use a good soap, warm water, wash for at least 20 seconds, and scrub. Scrubbing is a big thing. Really get in there and scrub. It can make all the difference. You're going to basically use some abrasion to get all those germs
maybe even
off.
a fingernail brush or something like that.
Yeah, if you can afford a fingernail brush, carry one around, sure. But try to get under those fingernails and all that. So
sing the alphabet song.
Yeah, sing the alphabet song. So yeah, they said that equals around 20 seconds singing that, or singing it twice or something like that. I forget.
The alphabet song. Okay,
But-
I forgot.
All right.
I forgot all about that.
Yeah.
Okay, we got a few seconds. A lot of people go to the stat care and then end up having to go to the hospital.
Mm-hmm.
How can we sort that out?
Well, I think that's kind of tough because, they probably went to a stat care for a good reason. They thought that maybe, or they just didn't know what the stat care could handle or something like that. But at least you're seeking out that, medical advice, and you usually reserve stat cares for any non-invasive procedures or
we're out of here.
yeah.
Okay. Sorry, we didn't get the
Oh,
whole
that's
answer.
okay.
Okay. Thank you very much to our guest, David Morris, Injury Prevention and Outreach Coordinator for Mercy Trauma Services. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here next Friday on WHBC News Talk, 1480.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.